Hello, Amref team. Welcome back to our diversity, equity, inclusion, and belonging journey. Today, we're diving into a topic that's all about the unseen forces shaping our decisions and interactions every day: unconscious bias. Unconscious bias is like an invisible lens we wear that shapes how we see the world, often without us even realizing it. Think about it, it's natural. Our brains are designed to make quick judgments to help us navigate complex social environments. But in healthcare, where fairness and empathy are essential, we need to make sure these quick judgments don't lead us astray. Let's start with the basics. Unconscious bias refers to the automatic attitudes or stereotypes that influence our decisions without us being fully aware. It's rooted in cultural conditioning and personal experiences that we absorb over time. While these biases are subtle, they can impact critical decisions, from how we treat patients to how we collaborate with our colleagues. And here's the kicker: unconscious bias isn't something to feel guilty about. We all have it. It's a natural part of being human. What matters is recognizing it and actively working to manage it, especially in diverse, team-oriented fields like healthcare. In healthcare, biases can sneak into everyday actions and decisions. For example, racial bias might make us unconsciously assume certain patients are less likely to follow medical advice, impacting the type of care they receive. Or we might show gender bias by prioritizing men's health concerns over women's, simply because of ingrained stereotypes about toughness and resilience. These biases are rarely intentional but can have serious implications for the communities we serve. That's why at Amref, addressing these biases is part of our commitment to equitable healthcare. We want every patient, every team member, to feel valued and respected. One of the biggest challenges with unconscious bias is that you can't change what you can't see. It's like trying to clean a smudge on your glasses that you don't even know is there. We need to bring these biases into the light before we can start to work on them. At Amref, we're committed to becoming aware of our biases so we can provide fair and compassionate care. Through this module, you'll uncover your own biases and understand how they impact the communities we serve. Whether it's through self-reflection exercises or discussions with colleagues, every step you take to acknowledge these biases is a step toward creating a more inclusive environment. Let's talk about how to recognize and address bias. Start with self-awareness and reflect on your daily interactions. Ask yourself, are my decisions based on facts or assumptions? You might be surprised at what you uncover. Then, seek out diverse perspectives. This helps us see past our own blind spots. And, importantly, use data. Reviewing outcomes objectively can reveal biases we might overlook on our own. These steps are about making sure that, no matter who we're working with, we're treating everyone fairly. Even with the best intentions, our actions can have unintended impacts, especially when unconscious bias is at play. This is where the intention and impact model comes in. It's a way to understand how our biases act as a filter between what we intend to convey and how others experience it. For example, if we hold a position of authority, we might intend to offer constructive feedback. But if our bias comes through, it could make the person feel unfairly judged or excluded. Recognizing these filters helps us ensure our impact aligns with our intention. Reducing unconscious bias is a journey. One practical step is to interrupt your own assumptions. Pause and question them before making decisions. Are you relying on a stereotype, or looking at the person and situation objectively? Remember, change doesn't happen overnight. But every bit of awareness we gain brings us closer to the inclusive, equitable healthcare Amref strives for. By working on our own biases, we're contributing to a culture where everyone feels respected and empowered. Thank you for joining us in Module 2. Together, let's continue on this journey of self-awareness, compassion, and equity. Ready to dive into the next module and build a more inclusive culture? We're just getting started.